Okay, everybody's ready. We'll call this meeting of the Richland Community Health and Services Standing Committee to order. Miranda, if you could do roll call, please.
Miller. Kramer. Here. Glassburner.
Here.
Harwick.
Here.
McGuire. Barris.
Here.
Braithwaite.
Here.
Chicker.
Here.
You have 6 for recording.
Okay, thank you. If you're in compliance with opening slot.
You can bar.
All right, then I would take a motion for an approval of our 11-point agenda.
I'll make that motion and I'll second.
All those in favor, please say aye.
Aye.
Opposed? Okay. Any changes or questions, comments on the minutes from the February 6th meeting? Not, we'll declare those approved and move on to number 6, public comment. Is there anyone here or online who would wish to speak as a member of the public? All right, moving on to number 7. A, HHS Director Admin Report.
So we do have the packet in the file, just a couple of things that I wanted to highlight. Our Children's Long-Term Support Program got the results from their records review audit and got a 94.4%. This is in the highest possible category, so great job to them and all the work that they do on that program. In economic support, we have offered the job to 2 of the open economic support positions, and they will be starting on March 17th, so that unit will be fully staffed after that. The ADRC is participating in the Disability Advocacy Day at the Capitol on March 12th. So if anybody is interested, you can reach out to the ADRC and join them on that day. And then the nutrition program had their audit, their assessment of their nutrition program. Sorry, I don't have my glasses today. I forgot them. That was completed for the 2022 to 2024 years. I had attached the letter in the packet, but it did not get uploaded, and I apologize for that. But overall, they did very well. They received a positive report highlighting the excellent meal, services, and compliance with rules while they enjoyed the meal at the Rockbridge site. So we want to congratulate Titania and Roxanne for their hard work on that program. As you may or may not recall, the nutrition program did go from public health to the ADRC. And so that was a very good transition, and things have been going very well for that. And then in our child and youth services, I did receive a letter earlier this week from the state complimenting them on their completing and documenting the face-to-face contacts with children in out-of-home care. So there is a requirement to meet with out-of-home care at least once a month, meet with children who are in out-of-home care at least once a month. And in the federal fiscal year of 2024, they had a 99.56% compliance rate. So that's very good. And that is something that a couple of years ago, we were on a project improvement plan with the state. And so they have continued their positive work in regards to that. Any questions?
Thank you, Tricia. B, HHS expenditures report. Anything to note on that, Stephanie?
I don't think so. I think we have our standard volunteer driver reimbursements, our paid invoices, our standard language line. We had a big purchase through CDW, used ARPA funding to stock up on computer monitors, mail site, Meso catering expenses. Looked through. Yeah, just nothing too jumped out. Did anything jump out to anybody? This was out of the ordinary.
Right, C, HHS budget summary and Richland County placement report.
So I put reports out there and I flagged them as final. I'm not going to go through 2024 again. For the most part, expenditures, you might see on the expense report, there was a few 2024s that still got posted back, but we're pretty much done with paying for any bills from 2024. Let's say we are done. I've already done some final cleaning in some of my programs, so we're done. We have to be. Still some revenue trickling in though. some CCS revenue we still have coming in. But yeah, otherwise, we're gonna end up with a core balance of about 195,000. That's what I'm coming up with. It's a little lower than other years, but we were a little bit higher in some of our expenditures as far as like the CCS program. So a lot of that revenue we'll see that continued.
Questions for Stephanie? Thank you. Great job, everybody. D, ARPA spending plan report.
We have a very rough draft of what was left. We're gonna have about $65,260 left that they'll have to do a new contract on. The difference, I did the final claiming for that. That's the number that I came up with using my calculator. And so Trish we met with Brandy Anderson, Public Health, and to see what were some of the things we think we might use the funding for in 2025. Again, this is to continue chip and chaw work to help continue to pay for at least staff to help with vaccine clinics. And then just some other miscellaneous things, things that we've been approved on in the past, so we have new subscriptions coming. We still have some remaining balance left, but I'm sure there's gonna be other expenditures that are gonna come up throughout the year that will reach out to the state and ask if it's an acceptable expense. Who asked us to share, so we got about $65,000 to play with.
Great. This looks good. Questions or comments? Yes, Cindy?
Just a reminder of how the monies are paid, I guess. Is this money the county has already received that we're spending down, or do we submit?
We submit for reimbursements.
And do we submit
For
to the
this
state or do we
department.
submit to the feds?
The state.
The state, okay. That's a little bit more of a sure thing these days.
I don't know this pot of money at the state level. I guess it's sitting at the state level. It's not sitting anywhere else. And I haven't heard that it's going to get taken away.
Thank you.
Yeah, no, good question.
It's a bit of a difference from the county as a whole, because as I understand it, the county was given a certain amount of money
Right.
to use,
And
whereas
the
we,
I believe, went in and took it down,
Right.
threw it all down, and it's
Right.
sitting in a,
Yep.
and we're
in a
spending,
pot. Yep.
whereas we have to submit, but
Yep. And submit reports on what we spent it on and how, what we used it for and stuff like that, along with our claims.
all right, anything else? Okay, thank you, Stephanie. E, HHS organizational report.
So this is just our organizational chart. I did put it in the file or in the folder. So if anybody has any questions, I just really wanted to update you on how things look, where we're at with workers and our staff authorization, where we're at. So that's there if anybody has any questions. I think right now we have 4 to 5 open positions. We have one where the person's still there until April. But we have started advertising because it is for our mental health therapist, which is a tougher position to fill. But overall, I believe there's just 4 open positions.
What is the key between the different colors?
So the yellow is considered part of our leadership team, and then the others are the staff.
Thank you.
F, contract monitoring report.
So this is something that we put in there, as you guys know or may not know, the policy changed last year with how contracts go. Previously, pretty much any contract over, I believe, 10,000 came to you for your approval. It changed last year that only contracts over 100,000 come to you. So we will continue to do our contract monitoring report. This is just a contract that we have out there, or the report that we have out there for right now, so that you're aware of the contracts that we have in place for 2025. The ones that are highlighted are ones that we don't have all of the information back yet. We have offered the contract. We're just working on finalizing and making sure we have everything in place. So I just wanted you guys to have this so you have a good idea of where contracts are at. One thing that has changed for 2025, one additional thing that has changed with our children's long-term support contracts are all being completed by the state now. Historically, we had to have those contracts in place, but the state has taken that over. And they now are responsible for contracting with our CLTS providers. And then there's a provider directory out there for individuals who want to use that program. So we do have less contracts that we had to do this year.
Questions from committee members? Okay. So G is 2024 survey results, and Tricia has also pulled in the results from 2023, so we can compare as well.
So one of the first things that I'll point out is that we did have less people complete the survey this year than the previous year. For the 2023 surveys, there were 36 responses. For 2024, there were 27. The first question that we asked is, do you find HHS could benefit from an employee wellness committee? Last year, we had questions about our all agency meeting that we hold once a month and how to make them better. This year, we looked into having a wellness committee. So 15 of the survey respondents said yes. So that is something we will be pursuing for 2025. It probably won't be huge. We talked about at our leadership meeting to maybe have a once a month event. Something could be small, could be something that we do over the summer months. So that's something that we will work on in the next week or two to get a committee established and then start working on that. The next question that we had, then the top 2 factors for your overall happiness at work. Many of these are the same from the previous year, really is the flexibility, their coworkers, really the joy they find in the job and finding that helping people is fulfilling to them. I think that's pretty important. The support, the teamwork, communication, those are all things there that people have found beneficial for working here, and the ability to work remotely. So we do have some staff that are pretty much home full-time, our economic support workers. About half of their team work remotely, but they come in the office 2 to 3 times a month to do an intake day. And that is something that has changed in the last couple of years with having them come into the office. We really wanted to make sure that they were connected with their coworkers, that the manager had the opportunity to meet with them face to face. So that was something that we changed, I believe, in the last year and a half. And then really there was share suggestions for improvements, comments, and other feedback. So consistent themes from last year to this year were the disagreements between the units, the lack of understanding about the duties of other staff, and particularly the front desk staff. There's consistent theme that everyone or that more staff would like a working cell phone to be able to communicate with their consumers. And then the feeling of being seen but not heard in their unit and wanting to have a greater voice in the unit. So those are consistent themes from 23 to 24. The disagreements between the units is something that, I continue to talk about. I know right now we are having a project between 2 units where the staff are getting together and really talking about how can they improve communication, how can we better serve families. There were things that as leadership team tried to accomplish, and I felt like we weren't getting anywhere, so we tried to put it in the hands of the employees. We'll see how that goes, but I'm just trying a different approach there. Other things there that we are working on right now is onboarding of new employees. So some units really have I think overall at HHS, the onboarding is really good. I think some units, because we have newer managers, just haven't figured out the best way to onboard new employees. So we've been having some meetings and working on that because we do want to make sure it's successful when new people come. And then I'm also working on improving communication. So that was one comment. A couple of comments were improving communication to staff about things going on within the county. So I am trying to send more emails out to everyone with updates. I do let the leadership team know, but I don't always let all the staff know. And so I'm trying to be better in regards to that. And then the wellness committee is something that we are looking to implement. So those were the questions that were asked. And then the next slide that is there really looks at the survey results.
You got your changed music?
I'm not gonna change the music. I did talk with MIS about it. They said it might be difficult to find a station that would be appropriate all the time. So, I said we better not start experimenting. That might not go well.
I
Yes.
guess I had the part about the county board or being out of touch
Yeah.
with the needs of the county. I guess, any expansion on that?
They didn't elaborate on that. They did not. I don't know. I don't know what that's about, if that's something that I can gather more information on. I think sometimes with certain topics that come up, but it might be something that the board doesn't necessarily address. I guess I'm looking at like health insurance. I know that was a big issue last year, that there were lots of concerns with the health insurance.
But this is with the needs of the community, not
Yeah.
necessarily the needs
These are
of.
the employees.
What was the timing? I'm just wondering what was the timing of the survey?
I handed it out in January. So it was like the last few weeks of January, 2 weeks of January, and I think the first week of February, if I'm remembering correctly.
Just wondering, was there anything going on topic wise at the time that?
Yeah. So what I can do to try to gather more information, they're anonymous surveys, but we do have them put their unit on there. So it is something that I can go back through the surveys, figure out which unit it went from, and then have some conversations with the manager. And maybe they can have some discussions with their staff as a whole to be able to come back with more information. You can do that.
It's definitely not to be punitive at all. It's just, it's difficult to make changes if we don't understand specifics.
Yep.
Well, then it's also difficult to know what might work to better bring about that understanding of what the needs are in the community, whether it's what's really going on with opioid use or opioids versus this versus that versus alcohol
Yeah.
versus economic needs versus housing, et cetera, et cetera.
Okay, yep, I will do some work on that.
I don't think that that's a new, I don't see it listed as such on 2023, but I remember from previous surveys, there's generally something similar to that on there. Haven't really heard again specifics on what that might.
So then you'll see what the questions were, kind of where the results were. One of the things that I really found this year was there were a lot more neutral responses than the year before. I think if you take the neutral out, I think, we are trending more to staff being happy with where they're at than being unhappy. There are some staff that are unhappy. And those are things that we'll work on. And some of the things that I see that, yes, we absolutely need to work on is kind of improving that communication and teamwork between the units. There are some that were better from from this year to last year. One of the things that we did better on is I know it is expected of me at work. We were better last year than this year, or we're better this year than last year. And then some we really remained the same. It's hard to know which way to move the neutral people.
Mm-hmm.
And you have to realize there will always be those unusual.
Yes, absolutely, absolutely.
Okay, any other questions or comments for Tricia? Thank you for putting that together for us. It's always helpful to get a feel overall of how things are going. So if not, moving on to number 8, discussion and possible action, resolution requesting no federal or state cuts to Medicaid.
So this is something that is, counties across the state are working on creating resolutions to take to their full county boards and then pass on to their representatives and senators. I am asking you to start the process to support No cuts to Medicaid right now. Out there is a proposal to have cuts up to $808 billion. That would be very harmful to our community. Right now in Richland County, about 28% of the citizens receive some sort of Medicaid. We have 69 businesses that benefit from Medicaid funding sources, and our ADRC receives 50% of Medicaid drawdown dollars, so that the work that is done by the ADRC staff is funded by federal Medicaid dollars. We have a lot of people that are aging or living with a disability in our county who receive Medicaid, and that provides them services to remain in their home. So that's through our children's long-term support program, through our family care programs. It really is a way to save money in the long run because it's a lot cheaper to provide services to individuals in their home versus having them go to a nursing home. Because that really would be the alternative if we don't have the Medicaid program support that we have. Just trying to think if there's other things. Medicaid does support birth all the way to the end of life. And so asking you to start this process for the resolution so that we can take it to the full county board.
So you're asking for a motion?
I am asking.
Then I would make it.
Okay, thanks.
And I will second.
Okay, further discussion or questions, comments? Michelle, how are you doing online? You're hearing us okay?
Yes, I'm good.
Okay. All right. Quiet bunch this morning. Well, if there's no discussion on this, good. We'll vote on it. All those in favor of this sending this resolution on to the county board, please say aye.
Aye.
Any opposed? Okay. Do we have any correspondence?
No.
All right. And thoughts on future agenda items? Committee members? All right, short meeting today.
No complaints.
All right, that'll take us then to our next one, to the date, and that is, hold on, I can get it.
April 3rd.
Yeah, okay, earliest. All right, so we'll adjourn to April 3rd. Do I have a motion?
I'll make that motion.
Okay, I'll second.
All those in favor, say aye.
Aye.
Opposed? I think so. Have a great day, guys.
Did he say we get it back today?
I'm not planning on it last time.
I like your hat, Dr. I like your